It's an antenatal class at this primary health center in Lagos. Nurse Tawa Kalitu is teaching pregnant women the danger signs in pregnancy and the importance of adequate nutrition.
Adequate means a proportion of carbohydrates, protein, fats, vitamins, and mineral salts.
Oyebola is attending the session for the second time. She is 5 months pregnant and expecting her first child. She is being examined to ensure her unborn child is growing accordingly. Antenatal or birth education classes like this do not just prepare mothers to be for labor and delivery. Studies indicate that regular attendance contributes to the success of proper nutrition for the pregnant mother and the growing child in her, and also improve the success of breastfeeding experience. But the challenge has always been that pregnant women in Nigeria do not often register for antenatal early. The percentage of births in Nigeria handled by skilled health personnel is 38%. Maternal death ratio in Nigeria is 576 per 100,000 live births, while infant mortality rate is 69 deaths per 1,000 live births. UNICEF says malnutrition is the prime reason for 50% of those deaths. This obstetrician gynecologist says appropriate nutrition and a healthy lifestyle even before conception will set a solid foundation for the first 1,000 days of life.
When we talk about reproductive health in relation to early childhood development, it is very, very important for us to emphasize the fact that every woman needs to keep a healthy lifestyle. A woman that smokes, of course, should remember that this is something that can affect our unborn child later in life. And when you are pregnant, you should completely stop alcohol intake, because alcohol has been found to be associated with a lot of abnormality of the unborn baby, especially what we call the fetal alcohol syndrome.
Nutrition does not work in isolation. Having children fully immunized against vaccine-preventable diseases is also vital in early childhood development. But the coverage of routine immunization in Nigeria has not been maximal. About half the children between 6 to 59 months do not receive vitamin A supplementation. Iron deficiency anemia is also an issue. 72% of children are iron deficient, and the prevalence among women of reproductive age is 49%. Pap is one of the first weaning meals introduced to babies in Nigeria. Pap is the Western version of custard. It can be made from white or yellow corn, guinea corn, or millet. Another food that has become popular in recent years with the kids is noodles, but food critics condemned the packaged food as being too high in sodium and preservatives. Tosin accidentally got pregnant with twins. She's already feeding her 7-week-old children cornmeal.
I
cannot exclusively breastfeed them. Don't you see how thin I look? If I should exclusively breastfeed them, what will be left of my flesh? That is why when they cry at the same time, I give one breast milk and the other pap.
This mother of 4-week-old twins says she is giving them breast milk and water.
It is not easy, but I am coping. When I breastfeed one, I take a break, then breastfeed the other. But when they continue to cry, then I give them enough water and they fall asleep.
Malnutrition cuts across Nigeria, but severe malnutrition is biting hard in northeastern Nigeria. The Minister of Health says the country is working with international AIDS agencies to treat acute cases.
What we are doing is to really, as part of a federal government response to the emergency crisis in the Northeast, we are really taking care of health and nutrition. And one of the things we are doing is picking them, doing surveillance, doing mapping, picking young ones and give them ready to make and use therapeutic foods, and then making sure that we feed them properly, balanced diet. And beyond that, we will then start about education, giving food supplement to families and so on, to make sure that we invest in the cerebral architecture of our children.
The minister also promised to scale up campaign for early nutrition.
The concept of the 1,000 days is a new initiative because we recognize that we should start counting in utero. And one of the critical things we are doing is to promote the nutrition of the pregnant woman. And beyond that, we are looking at promoting breastfeeding. And we have launched a big initiative on promoting breastfeeding in Nigeria. Nigeria used to be a predominantly breastfeeding nation. But over the years, because of affluence, because of education, we started copying Western culture. We abandoned breastfeeding, which actually is not good enough.
Having soda and buns from refined flour and sugar for breakfast, like this nursing mother is doing, is not nutritious. There are a variety of foods to choose from that are rich in essential nutrients for the mother and her growing child. Of the 289,000 maternal deaths globally, Nigeria has the second highest mortality rate after India, with about 40,000 maternal deaths every year. The need for proper nutrition for pregnant women and newborns is non-negotiable. Let's support the first 1,000 days of our children. Vivienne Irikefe, TVC News.